Hi, my name is Caitlin Trujillo, and today I'll be talking about opioids. What are opioids? Opioids are naturally found in opium poppy plants. They are most commonly used as a pain reliever as they block pain signals between the brain and the body. The most common uses of opioids are prescription opioids such as Oxycontin, Vicodin, codeine, and morphine. A synthetic opioid by the name of fentanyl, which is 50 to 100 times more potent than morphine, and heroin. Using opioids. Opioids are meant to only be used to relieve pain or pain control. Regular use can increase tolerance and dependence, leading to more frequent and higher doses, and can easily lead to addiction. All opioids are chemically related and interact with opioid receptors on nerve cells in the body and the brain. Opioid pain relievers are generally safe when taken for a short amount of time and as prescribed by a doctor, but because they produce euphoria in addition to pain relief, it often leads to the misuse of opioids. Regular use, even as prescribed by a doctor, can lead to dependence, and when misused, opioid pain relievers can lead to addiction, overdoses, and deaths. Here are some of the effects of using opioids. First is pain relief, as opioids is typically prescribed to treat moderate to severe pain. Next is constipation, nausea, confusion, drowsiness. When opioids are taken in high doses or misused, it oftentimes can restrict the ability to breathe. It also leads to addiction, as a lot of people are chasing the relaxed, happy, high, and euphoric feeling that opioids give off. Lastly, signs of an overdose include cold and clammy skin, cyanosis, which is a bluish-grayish discoloration of the skin, and pinpoint pupils. The opioid epidemic. In the late 1900s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This led to widespread misuse of both prescription and non-prescription opioids before it became very clear that these medications were actually extremely addictive. The U.S. Department of Health and Human Services officially declared a public health emergency in 2017 in response to the ongoing opioid epidemic. For our last slide, here are some statistics on opioids. 48,006 people overdosed on opioids in 2020. At least 71.8 and as many as 80% of overdose deaths involve opioids. Overdoses involving opioids increased 519.38% from 1999 to 2019. 68% of all overdoses are attributed to synthetic opioids. This is mostly seen due to the cutting of drugs with fentanyl, which is the synthetic opioid that is causing a lot of the overdoses that we hear about in the media. 3.10 million people abused opioids in the past month. On average, 103,333 people are using opioids per day. 10.07 million people aged 12 years and older abused opioids in 2019. 42,700 people overdosed on fentanyl in a year. Overdose rates on fentanyl are rising 2.5 times faster than heroin overdoses. This is largely because a lot of people who are consuming any form of drug, whether that be a powder or a pill or a liquid, is not aware that these drugs are heavily being cut with fentanyl, and even a little can cause a deadly overdose. Prescription opioids are a factor in 32% of opioid overdoses, which lead to death. Pharmacies fill 153 million opioid prescriptions in a year. And finally, doctors write enough opioid prescriptions for 46.7% of Americans to receive one. For our last slide here, that concludes my presentation on opioids. Thank you guys for watching.